How common is oral cancer all over the world?
As per the world statistics, around 4 lakh new cases are diagnosed every year. Asian continent is the topmost contributor to oral cancer. 2 lakh 70 to 2 lakh 80,000 cases from Asian continent.
So what are the common causes?
The use of tobacco. The next important after tobacco is alcohol. If you use tobacco and alcohol together, it almost increases the risk of you developing cancer by 30%.
How difficult it is to quit smoking?
If a person wants to stop smoking, he can stop it.
What are the early signs of detection then?
A patient starts to feel burning sensation in his mouth.
If you find something suspicious, then what are the important investigations which you or diagnostic test which you do in the early stages?
There are tests like you do a brush biopsy,
How important is biopsy?
go for cancer,
What are the treatment options?
surgery.
How successful is the surgery?
These diseases are staged as stage 1, stage 2, stage 3 and stage.
But if someone has an early stage, will just lifestyle change revert or help in any of the cancer changes?
You can reverse.
Any myth or any misconceptions?
Person with cancer can be treated successfully, can live a good quality of life.
Red patch or white patch, which is more concerning? Namaste everyone. Welcome to one more episode of podcast with me. I am Dr. Amitabh Kulkarni. This is the platform where we try to simplify complex topics with the help of experts in the field. Today's topic is something that needs more attention than what actually it is getting. Oral cancer. Now, it's one of the commonest cause of cancers all over the world. But what is tragic about it is the lack of awareness, early detection. It's very difficult. To simplify this topic, I am happy I am joined by Dr. Bhushan, who is an experienced oral and maxillofacial surgeon. He has been dealing with these cases for years together. He is going to share with us how to identify it early, what are the treatment options available, and what are the risk factors which are usually associated with this cancer. Thank you, Dr. Bhushan, for accepting the invitation and joining our podcast. Dr. Bhushan, can you tell us something about your background?
Thank you, Dr. Amitabh, for inviting me to be a part of this podcast. I am basically an oral maxillofacial surgeon, did my undergraduate and postgraduate training from India, and I have worked for almost more than 25 years now in the field of oral and maxillofacial surgery with a special interest, or you can say a passion about oral cancer. Following my undergraduation and post-graduation, I went to the UK where I finished my fellowships from Royal College England and Ireland. And then for the last almost 13 years, I'm working in the UAE as a consultant oral maxillofacial surgeon.
Thank you very much. We are very lucky to have you here, Dr. Bhushan. Let's get started. So, Dr. Bhushan, how common is oral cancer all over the world today, and what do you think is the awareness about it?
It's a very good question that you asked, Doctor. According to the GlobeCan, which is the Global Cancer Observatory by the WHO, according to their data, if you list or rank the cancers, usually the first one is lung, followed by breast. So in that sequence, oral cancer is around the 16th common cancer worldwide. Yeah, and however, it has a far more devastating effect because it affects the face and the oral cavity, which is a very important area of human being. As per the world statistics, around 4 lakh new cases are diagnosed every year. But one interesting fact is about 2/3 of them, that is almost 2 lakh 70 to 2 lakh 80,000 cases, 280,000 cases come from Asian continent.
Okay.
And that is because in Asia, apart from the use of just smoking tobacco, we have a very rampant use of the smokeless tobacco, which is also equally harmful. And because of this, the Asian continent is the topmost contributor to oral cancer.
Yeah. So you mean to say the ranking will be a bit higher in Asian
Yeah,
subcontinent
definitely,
as against the
yeah,
world? Okay,
yeah.
that's very important. So what are the common causes then for this cancer?
See, I mean, it's a very well-known fact that everybody is aware of, but don't really recognize it. Is the most common factor that is seen in all cancer patients is the use of tobacco.
Tobacco.
Yeah, tobacco contributes to almost 60 to 70% of the cause for oral cancer. One thing which is very interesting about tobacco is many people think that it can only cause oral cancer, but tobacco has been implicated in more than 15 to 16 cancers,
Wow.
including stomach, bladder, prostate. So it's a very potent what they
Risk
say called
factors, yeah,
risk
common
factor or
cause.
carcinogen.
So then, can a poor oral hygiene or some chronic inflammation, all in the mouth cavity, can that also lead to oral cancer?
Yeah, poor oral hygiene and chronic irritation, especially if you have a ill-fitting denture or if you have fillings that are not proper, which are constantly rubbing against the soft tissues of the oral cavity.
Sharp tooths and all.
Yeah, sharp teeth, if they are not taken care of at an appropriate time. So all these are contributing factors. Apart from that, just since we are talking about the causes, the next important after tobacco is alcohol. And
Okay.
if you use tobacco and alcohol together, which
Together.
is done in many people, it almost increases the risk of you developing cancer by 30%
Oh.
than if you do them alone. Yeah.
Yeah.
And
So
alcohol has a role wherein it helps in the cancer producing substances of tobacco. It helps it to easily enter the cells, and it contributes in a big way if you are using it along with tobacco. Also, one of the other causes now which is being detected mainly in the West is the human papilloma virus,
right.
especially human papilloma virus number 16, which is a sexually transmitted disease and is common in people who have a practice of oral sex, unprotected oral sex. So these are the main risk factors.
Risk factors. Now you did mention about smoking or tobacco, but what about vapes or electronic cigarette, which are claimed to be a safer option?
No, I mean, I really don't see that. There are, I mean, they are relatively new in the market.
Correct.
But even then, the recent studies are showing that they have a very profound implication or a causative effect. And
For oral cancer
yeah,
as
for
well.
oral cancer, because although you are not inhaling the smoke, you are still inhaling the carcinogens, especially if you are using tobacco.
Correct.
And the other thing what vapes do is they change the microbiology of your mouth. That is, they allow a lot more of fungal growth. And fungus is also a very significant trigger point to induce the cancer changes.
Yeah. So in that case, someone who has oral cancer or who is at a high risk for oral cancer, how difficult it is to quit smoking or tobacco or vapes or all these things? Yeah.
It's a very good question. See, I have seen in my sort of 20 plus years that if a person wants to stop smoking, he can stop it now.
Okay.
And there are people who I have seen who are waiting tomorrow for cancer surgery, but they can't resist. They have to go for a smoke, and so there you have a whole range of population.
Yeah.
But yes, it is a little difficult once the habit develops.
Yeah.
And one of the common things what we have noticed is if you develop the habit early, like if you're in your teens or you're in your early 20s 30s, then it is that much more difficult to give up the habit. But now there are multiple helps that you can get. I mean, apart from the helplines and things like that, you have the nicotine patches, you have the chewing gums, so they take away the drive for you to use tobacco. And yeah, I mean, it should be a thing that we should consider seriously if we are using tobacco very heavily.
Yeah. So viewers, please understand, smoking in any form whether it is tobacco or cigarette or vapes or e-cigarettes, all these are high risk factors, very potential risk factors for development of oral cancer, and try to stay away from all these addictions. Now this we spoke about, say the causes and all. What are the early signs of detection then?
Yeah, see, the most commonest sign I would say is if a patient starts to feel burning sensation in his mouth for the type of food which he usually is accustomed to. So that is a very early sign which a person should not be neglecting. Okay, apart from that, a person can spot a white patch or a white and red patch in his oral cavity. Or the other common thing is if they develop an ulcer which is not healing. Ulcer is like a wound in the gum.
Yeah.
Okay, so it is there, it is persistent for more than week, 10 days. You have tried to local applications. So if you see or detect that in your mouth, or somebody has detected it for you, you need to immediately seek help.
Correct.
And get it investigated further.
Yeah, you did mention about non-healing ulcers. So how long they can wait before it?
Yeah, in simple terms, anything that doesn't heal in the oral cavity, it might be an ulcer, it might be a patch, it might be burning sensation. Okay, so if it doesn't recover within 2 weeks, then it needs to be taken seriously.
Okay.
Sometimes we get used to it because we tend to neglect it.
Yeah,
Okay, but anything, if you feel that it is not getting reduced or healing in 2 weeks time, you should seek professional help.
Yeah. So then, if someone develops some sort of a patch or the symptoms which you just described, and if they notice it in early stage, what should they do? They should just visit you and
yeah, see, the first line is always either a physician or a general dental practitioner.
Yeah.
And many of the physicians or general dental practitioners are aware, and especially if you are a high risk group, that is, you have a regular use of tobacco, may not be very heavy, but if you are a regular user of tobacco, alcohol, then you fall under the high risk category.
Yeah.
So you should seek professional help either from the general dental practitioner or a physician who are the frontline doctors, or if you are not very comfortable, you can seek help of a professional who is dealing with oral cancers regularly.
Yeah. So viewers, please understand, this is one of the important message Dr. Bhushan want to convey. Like if you develop any new ulcers or a patch which is not healing for more than 2 weeks, please visit your nearest physician. It can be a general dentist or an internal medicine whom you have been seeing, and just try to get it clarified as early as possible. Now, many a times our human tendencies, unless it is painful, it's not that important. Sometimes you may develop some sort of a small ulcer which is like a painless ulcer, or some white patch or red patch as we discussed. It may not be painful. So is it a criteria to say that this is okay, it's not all that what I would say malignant or important?
See, from, if you ask me personally, from a patient point of view, if they see something untoward in their mouth, which is like I mentioned, an ulcer, a white patch or something, whether it's painful or not, usually these things are, even if not very severely painful, mildly painful. And like I said, one of the common symptoms is the burning sensation in the mouth, especially for, like, if you are eating a particular type of food regularly, you are fine with it for a few days and you develop the burning sensation, or you are finding it difficult to eat that type of food, then yes, you need to. So pain is per se not the criteria.
Correct.
Yeah. So even a painless thing, I mean ulcer or a patch, can be a precancerous condition.
Yeah. So this is another important message, whether there is a pain or not, even if it is a painless, but it is something new you have noticed, as you clearly said, you should get it reported. Now, are there any specific sites in the oral cavity which are like at predisposes to this sorts of ulcers or patches, which indicates that there may be, or anywhere it can happen?
Yeah, see, the most common site where we see this is in the tongue.
Tongue. Okay.
But the other areas, like especially if people have the habit of chewing tobacco, so they usually have a tendency to place the tobacco or the quid, what we call, in particular areas.
Correct.
So those areas have to be monitored regularly because those are the areas where this can start. But overall, the whole oral cavity, it has multiple sites like the lip, the cheek, the gums, the tongue, the floor of the mouth. So it's better to keep all of these under surveillance.
So it can happen anywhere,
Anywhere in the oral
in
cavity.
anywhere in the oral cavity. So if someone is coming for a checkup per se, so what is your role as a surgeon in early detection in these cases then?
Yeah, so when they come to us for any oral
Routine
checkups or this
checkup,
thing,
yeah.
so the main thing that we see is that the oral mucosa has to be pink. It's called
Okay.
healthy pink, which
Right.
a trained eye can pick up.
Yeah.
So it has to be nice, healthy pink all along,
Correct.
like in the cheek, in the lips, in the this thing. Sometimes people do develop some blackish pigmentation as they age for other reasons like hormonal changes.
Yeah.
So you need to be taking that into account, but it should be healthy pink.
Correct.
And there should not be any hard masses or any lumps, okay, that are seen in the oral cavity. So those are the things we check, and also we check for the lymph nodes in the neck, because sometimes the lymph nodes can be an indicator, especially if you have a cancer in an area which is not easily visible or seen.
Correct.
So you need to examine these factors.
So if you find something suspicious, then what are the important investigations which you, or diagnostic test which you do in the early stages to pick it up early?
There are tests like you do a brush biopsy, what is called, which
Brush
is just you take the superficial
Scraping, yeah.
scrapings and this thing. You can even do cytology, but these are not very conclusive.
Yeah.
The most conclusive, if you are suspicious, is a biopsy.
Biopsy.
Yeah,
Biopsy. That
biopsy
was
is
actually
the-
my next question. How important is biopsy then
Yeah,
in that
the
case?
biopsy is 100% confirmatory.
Yeah.
So it will tell you whether you have proper cancer or you have something called as dysplasia. That is, you are prone for cancer. And then if you have cancer, how big it is, how deep it is. So the most conclusive diagnostic test.
So
would
if
be
there
the
is a
biopsy.
suspicion, biopsy is the test to diagnose whether it is in the early stage or, as you said, dysplasia or various stages. What about the other conventional radiological tests like CT scan, MRI, or any of these are helpful in diagnosing staging or any other?
Yeah, I mean, CT is very important when the malignant tumor or the cancer is attached to the bone, because CT
Okay.
shows the bony lesions much better.
Yeah.
If it is purely in the soft tissues like the cheek or the tongue, then MRI has a role. In early detection, they are not that this thing. It's only once you have a confirmatory diagnosis or you are very suspicious that this is the thing, then you do these. Okay, to
So you
see
need not do CT scan immediately, but you try to confirm that with the biopsy first, and then later on.
it is a little this thing, because if you just have a suspicion that this might be dysplasia, you do a biopsy. But if you see a frank growth or you see a frank tumor or a hard mass,
Right.
then it's always better to do the MRI or CT before, because
Okay,
when you do the
yeah,
biopsy,
correct.
then the swelling, the edema can change the picture in the biopsy.
So this all, I think, only by experience you are going to tell. So that is why it is very important to take experts' opinion if you have developed any such lesions. Now, what are the treatment options then? Once it is diagnosed as oral cancer, then what are the various treatment options available?
The front line or the main treatment option for oral cancer is surgery. Okay, the surgical principle in simple terms is you have to remove the visible disease with a margin, we call. So
Okay.
that is, you have to take some amount of normal tissue also with it. And usually for cancers, the recommended margin is about 1.5 centimeters.
1.5 centimeter.
So you have to remove the visible disease, and based on your initial assessment, that is the biopsy, which shows the depth of invasion and things like that, and the CT MRI, you have to decide whether you want to do a neck dissection.
Okay.
Because the first stop where the cancer goes from oral cavity outside its original site is the lymph nodes.
Lymph nodes.
So we have to do a clearance of the lymph nodes. So this is the basic treatment. Then based on your final biopsy report, you have to decide whether the patient needs radiotherapy plus or minus chemotherapy. So these are all discussed on tumor boards now. It's not individual decision. So once you have the biopsy and the CT scan, so you formulate a plan along with other medical specialties like the radiotherapy specialist and the medical oncologist who gives chemotherapy, and you come to a plan and then you follow the treatment plan.
Yeah. So then you mean to say for most of the cases, do they need chemotherapy and radiation, or it depends on the staging and all?
Yeah, it usually depends on the staging. An early stage disease which is very small, which is very superficial, there is a demarcation beyond which you have to consider adjuvant therapies, that is chemo or radiation.
Correct.
Okay, so the early stage disease always gives the best result with the least amount of treatment.
So, in your experience or overall this analysis, how successful is the surgery if it is identified in the early stage?
Okay, that's a very, very important question.
Yeah, I'm sure all patients must be asking you this question.
Because literature has shown time and over again that if you can, to give a small background, these diseases are staged as stage 1, stage 2, stage 3 and stage 4.
Okay.
So it's based on multiple criteria like the size of the lesion, lymph node involved. So I'll not go into detail. But if you can pick up a disease in stage 1, okay, you have more than 90% chance of curing the disease.
That's very good.
Okay, so you will go back to almost normal life. Yes, you need some surveillance, but you don't need to this thing. But as you go down the stage, then like at stage 2, the chances of this thing come down to about 70 to 80%. Then at stage 3, 60, and stage 4, it's about 50%.
Yeah.
So the most important
very important take home from one of the take home probably from this is if it is identified early, it will help for treatment also and better quality of life later on. Now, if someone who is there is an important role of lifestyle changes in prevention. But if someone has an early stage, will just lifestyle change revert or help in any of these cancer changes?
No. Once the cancer is diagnosed, you have to treat it. It cannot be reversed. You can reverse some of the precancerous changes, okay, like what we call as leukoplakias and things like that. If you stop the habit, to some extent they can be reversed. Okay, I mean people have even tried antioxidants and all that to reduce the risk of them changing it to malignancy, but you cannot per se reverse.
So it can be prevented by modification of lifestyle, as we already discussed, quitting smoking and all those hazardous material. But once it develops, probably lifestyle is important. You still have to stop smoking and all, but ultimately the treatment is important. Now, someone who is at high risk, as we discussed earlier also, smokers, vapors, tobacco, how frequently they should go and screen themselves to check if they have any early signs of this deadly disease?
Usually they need a follow-up between 3 to 6 months. If you are not having any symptoms, you can get once in 6 months. But if you see a white patch, you see a red patch, or you have any suspicious looking areas in your mouth, or you're developing an ulcer repeatedly in one place, then you need to get it checked every 3 months.
Every 3 months.
Yeah.
Yeah. So that's also very important message. Now, what is your message for someone who thinks, oh, it won't happen to me? Yeah. So, what is your strong message for someone who is at high risk? He may have developed some ulcers, but then it's a human tendency. No, it won't happen to me. I am quite fit. Yeah.
What you are saying is basically denial.
Yeah.
Denial is
true.
one of the major problems when it comes to. I mean, I have seen patients whom we have diagnosed with a biopsy. They say, no, how can I get it?
Correct.
I am fit. I am going 10
yeah.
kilometers walking. I just smoke 4 cigarettes, 5 cigarettes. That is not any this thing. If you deny, you are making things worse for yourself. It's best to accept a diagnosis and get appropriate treatment and see that you modify your lifestyle so that it doesn't come back again. And just while we are at this, there is no definite this thing that a person who doesn't smoke or drink will not develop malignancy. Because like I mentioned, the papilloma virus, sometimes
so many other risk factors are there.
Sometimes we often overlook. We have a sharp tooth or something. I mean, it's constantly irritating, but we get used to it. And people just neglect those things. And it needs regular checkups. And when they see a dental practitioner, usually they pick up these things. But we cannot say that because I don't smoke or drink, I will not get cancer. It can happen in anybody.
So viewers, this is another important message. Whether don't think that it won't happen to you just because you don't have those traditional risk factors. Like sometimes, as I said, even a sharp tooth, sharp irritating tooth causing ulcers and transformation into cancer is possible. So coming to the last question of today's very important and informative podcast, any myth or any misconceptions you have seen in your patients which you think you should clear it today, something which you just need to clarify it today?
That's again a very important question because many people, once they are diagnosed and they start accepting that I have cancer, they start going into this thing that I'm going to die. So that is no longer, I mean, probably 20 years when we started training, that was the thing. But now there is so much of evolution of medicine and surgical techniques and other help these things, that a person with cancer can be treated successfully and can live a good quality of life for whatever period he has. So that is one myth that I would like to clear.
So it's a curable disease with so much of advancement in various options of treatment. Thank you very much, Dr. Bhushan, for taking all these questions and answering it in very crystal clear manner. Now coming to the second part of the podcast, wherein we try to discuss some interesting questions which should have at least one liner or maybe at the most one sentence probably in the answer. So are you ready for that? Thank you very much. Most common site of oral cancer you have seen? Tongue. Okay. Red patch or white patch, which is more concerning?
Red patch, definitely.
Red patch. Okay.
Both together, yes, but red patch is
Now you say tobacco with alcohol. Yes, it is not advisable, but tobacco or alcohol, which is a bigger culprit? Tobacco. Okay. One habit you wish everyone would quit today? Smoking. Yes, very important and strong
I would
message.
say any form of use of tobacco, because we see other forms of use also, but you stop tobacco. That would be one.
In overall experience, what is the common age group that is affected with oral cancer?
Usually now it has become 30 to 60 years.
30 to 60. It's a quite wide range now probably. Early detection, is it always by luck or awareness? Awareness, yes, of course. One simple oral check everyone should do monthly.
Just see in the mirror and see if there is something that doesn't look
untoward, unusual, something new that is showing up. Painful or painless, how do early lesions start?
They can be painless, but mostly they start showing some signs of pain and discomfort.
pain or irritation
Yeah,
or
irritation.
discomfort. Yeah, yeah. One word that defines your message on oral cancer. Or
Early
one
detection.
early detection. Yes,
Early
it is
detection.
very important. Your advice in one line to every smoker listening. It should not be a surprise.
Stop today.
Stop today.
Now,
Yeah.
stop now.
Yeah. So thank you, Dr. Bhushan, for clarifying all the doubts. This brings to the end of this very informative and interesting podcast with Dr. Bhushan. Uh, Friends, please understand, as Dr. Bhushan clearly said, uh, early detection is the key. If you detect it early, the treatment is going to be easier. And with a proper treatment in early stage, probably surgical, the chances are more than 90% that the disease is completely cleared from the body. Uh, Please do remember all the risk factor which he has mentioned, with smoking in any other form, HPV, irritating tooth, how often we should be going for a checkup if you are at a higher risk for development. So Dr. Bhushan, thank you very much for clearing all these doubts. Friends, if you found this episode very useful, please do subscribe to the channel, share it with someone who is at a high risk for development of oral cancer, or whose near and dear ones are suffering from oral cancer. It's going to be useful for them. Yeah, if you have any questions or doubts related to today's discussion, please do write it in the comment box. We will be very happy to answer those. If you want Dr. Bhushan to discuss any other topic from his specialty in future, please do mention it in the comment box. We'll request him, depending on his availability. We will try to arrange another recording with him. This is me, Dr. Amitabh, with Dr. Bhushan, signing off from today's episode. Please remember, prevention is better than cure. Thank you very much. Thank you.
Thank you, Dr. Amitabh. And just one sentence,
Yeah,
quick,
sure.
that it's the most appropriate month that we are doing this,
Oh,
because
wow.
though not many people are aware, November is the awareness
Wow.
month for oral
Wow.
cancer.
Wow.
Like
Wow.
October was for breast cancer.
Correct.
So November is for that. So I think
Yeah.
it's the most appropriate time we have had this discussion.
Yeah.
Thank you very much.
Thank you very much. Yeah.